I'd like to introduce CLICS, the Central Locality Integrated Care Service. It offers a new approach to providing care by integrating community assets with general practice-based care and recognising that a person's health and how they feel can be affected by a number of things that don't always need a medical solution. There are two key functions. One, community development, to help support and develop community assets, led by community development workers and volunteer coordinators. And two, the practice-based teams, who will support people on the CLICS pathways. This short video will explain CLICS in more detail.
I'm one of the advanced practitioners on the CLICS programme, and this week I've been speaking to and seeing patients, and it feels very different already. I think this is because I've really been able to explore their issues and I felt much less time constrained. I think we're getting better engagement because of this. Patients really like that extra time that we're able to spend with them, which is encouraging them to really open up and allow us to get to the nuts and bolts of how we can support them with the health issues.
We just started rolling out the service in our practice, and I've telephoned a few people this week to invite them onto the service. When we've contacted these people, they've been really positive about the offer, and I've accepted. I think they love the idea of being contacted proactively and having time to go through the care needs. From my perspective, it's been really nice to have that one-to-one connection with the patient. It feels like we're really involved right from the start of the care, and we think they really appreciate us giving their time to talk. I'm looking forward to being part of the CLICS team because already it's an exciting project. And even just the initial phone call, we can already see the benefits and difference this makes.
As an advanced practitioner, my role is to lead on the care pathways that need medical input. I have a range of skills to offer, and CLICS is giving me the opportunity to provide holistic care for my patients, working alongside other community colleagues.
We are part of the new CLICS team and are here to help and provide support to members of the Central Locality in Bradford. The new CLICS service will include working closely with advanced practitioners. Here we can gain a better understanding of individuals' needs and ensure the right person supporting the patient with an overall holistic approach. Each practice has a named community connector who will be attending weekly MDT team meetings.
The new pathway in CLICS includes meeting people and assessing their needs, connecting and accompanying individuals where required to most appropriate services. This can be achieved by empowering, supporting, encouraging them to access the relevant support they require. Working with the community development teams, we can link in with the community assets, and if we find any gaps in the service, we can feed this information back to them.
Volunteer coordinator element of the CLICS programme is a new and exciting part. We know that volunteering can help reduce isolation, loneliness and improve mental well-being and physical activity. So this role is going to help create meaningful opportunities with people who live in our communities. These may be identified by the practices-based CLICS team or from conversations within existing community groups. As a volunteer coordinator, I can support people to improve their well-being either through providing health and well-being training, which can then be shared amongst their friends, families and neighbours, or by supporting people within the community groups.
My role is a community development worker within the CLICS project. As a community development worker, I will help link the practices with community groups and create a better understanding of how they work and how they operate. I work for an anchor organisation. My role is to carry out a mapping exercise to understand gaps in provision and work with current groups. An example of my work is working with the elderly group, both as individuals and groups during lockdown.
We know there are different approaches needed to reduce health inequalities. An approach that recognizes that the communities we are born, live, work and socialize in have a significant impact on our health. Our CLICS teams have people with expertise in primary and community care. This means that our teams can access a range of services and support people in improving their health and well-being. Not only will these services look to improve how people are feeling, there are also opportunities to improve their skills through elements such as volunteer training program. We are really excited about CLICS in our Bradford city and cannot wait to make improvement for our communities. Let's do it.